Hello and welcome to the next episode of the Psychedelic Medicine podcast. I'm Dr. Lynn Marie Morsky, your guide on this journey, and today we're going to be discussing the roles of music in a psychedelic session with Dr. Eric Sienknecht. Dr. Sienknecht is a licensed clinical psychologist and co-founder and lead trainer at Polaris Insight Center, a ketamine-assisted psychotherapy clinic and training center. Dr. Sienknecht has worked as sub-investigator and study therapist on the Lykos-sponsored MDMA-assisted therapy clinical trials for PTSD, and currently is also a supervisor and educator in MDMA-assisted therapy for various clinical trial sites. He has a deep interest in the role and use of music in ketamine and MDMA sessions and specializes in curating playlists for psychedelic experiences. Now, before we get to Dr. Sienknecht, just a reminder that the Psychedelic Medicine podcast is for educational and informational purposes only. Nothing here is to be construed as medical or legal advice. And one last reminder, as always, if you are a clinician and you would like to learn more about psychedelics, please check out the Psychedelic Medicine Association. It is our mission to get clinicians of all types, doctors, nurses, PAs, therapists, social workers, across the board, up to speed on psychedelics so that you feel comfortable when patients come in asking about psychedelics, because we know they are. I have sat at conferences and they come up and say, my patients are asking about microdosing. They're asking about the clinical trials. They're asking where I can access this psychedelic or that psychedelic. And so we want you to feel comfortable having conversations about psychedelics with your patients. So please check out the Psychedelic Medicine Association at psychedelicmedicineassociation.org. Now, without further ado, thanks so much for joining us today, Eric.
Thanks for having me on, Marie. Really excited to be here.
I have to ask before we get started. I did not ask this beforehand, but Eric, are you also a musician?
I'm not a musician or formally trained musician, but I think about myself as a musician at heart.
You feel the spirit of it. I like that. I like that because it says here, you're into the role of music, and you could be very into the roles of music without being a musician. But I always have to ask, as a budding, drummer and bassist myself, there are definitely parts of music during psychedelic experiences that call to me in one way or another. And I've always felt it was very integral to the experience. And so I am very excited for this conversation that we are having. You recently wrote a chapter in a book. The book is called Integral Psychedelic Therapy, and the chapter is about music in psychedelic experiences. And so I'm really stoked to get into this discussion today. When you started off in psychedelic therapy, like how did you first start to realize the importance of music in the sessions?
That's a great question. I think, I would have to go back to kind of my own personal experiences with using music in my own psychedelic sessions to kind of answer that question. That it was a learning process over many years to kind of find the music that worked for me, that kind of carried me through, that supported me, that helped open doorways to visions, to non-ordinary states of consciousness. And so it was a process of trial and error. And I'm a collector of sorts. I like to collect music and tracks and build playlists from the tracks that really speak to me and I know kind of support me through various phases of the psychedelic experience.
Go ahead.
So yeah, when I got to psychedelic therapy and was actually doing it clinically, I kind of had a lot of
Oh, I think we cut out. I think Zoom just cut out for a second. What did you say? You had a lot of.
You just had a lot of practice.
Yes. Thank you. Zoom just, there was like a glitch in the matrix there. There were so many things you brought up there that I want to ask about. Three things that popped up that I will ask at some point, but I love how you pointed out what worked for you. And so we're going to discuss, is psychedelic, music selection for sessions, how much of it is personalized versus how much is kind of universal, because I know they've done some research and like there were some trends, but there still has to be I imagine, a lot of individuality in people's preferences. Another thing you brought up was phases, how different phases of the journey require different types of music. And so that's part that I'm sure is important in the curation of a playlist. And then also, like so at some point in time, I would love to dig into some of the research. So, how did you start off when you were writing this chapter of the book? Like, where do you start in helping people? We have people out there who may be therapists and they may want to be curating playlists for their clients. We may have people out there who are undergoing, let's say, ketamine sessions at a place that doesn't curate playlists for them. And so, what are some of the things that where do we start in this discussion about using music and the role of it in the session?
Yeah. So, you know, with, the personal versus the universal question, I just want to say that, a taste is musical taste, artistic taste is very personal. And that you can't say that like, this music or this album or this kind of music is like good music and this other type is bad music, right? It really depends on the listener and their taste. And so it is very individual. And there's generally better tracks to use for the opening phase of a journey, for the peak phase of the journey. And there's been some research into that as well. And the chapter that I wrote, it's called Dimensions of Attunement, Music, Listening, Resonance, and the Vibrational Field in Relational Psychedelic Therapy. And in the chapter, I go into some of these, in a way, kind of less interesting general principles around the roles of music and the curation of the playlist. But I try to also get into more of the nuance of sitting with clients in the clinical session, attuning to them, not just, like cognitively, intellectually, but emotionally and even energetically. And that we're kind of sharing this field together that is enhanced by the medicine. And that, like subtle attunement to various verbal and nonverbal expressions of from the client about their experience is really where it's at. And there's a kind of it's hard to teach that these more subtle nuances, ways of being with clients and attunement. And one of the best ways to learn that is through having your own personal experience with the medicine and with music, and learning about that through your own experience. But I try in the chapter to kind of hint at some of the nuances there, that are kind of more subtle, and they're often not verbal. There's like multiple ways of attuning. In regular talk therapy, we're rely mostly on, well, at least traditional talk therapy, verbal exchange and verbal communication. But there's the somatic level of listening. There's a energetic attunement, vibrational attunement, transpersonal attunement, even. So anyway, that's kind of go into those nuances a little bit more.
Let's dig into some of that. You said there's been some research done on the different what to play during the different phases. Can you go a little bit into what that research has shown or found?
Yeah. So, Helen Bonney and Walter Ponke wrote, I think, the first academic article on the use of music in psychedelic sessions in 1972. They were working with LSD and people undergoing LSD psychotherapy. And one of the main things that came out of that paper for me is kind of distinguishing phases of the journey. that there's an opening phase where not much is happening, at least in terms of the medicine effects. And then there's a kind of building phase where you start to notice the effects of the medicine. There's peak phase where it's, the most effects, and then there's a kind of coming down from the peak. Forget the name that they described for that phase, but I call it the long tail, or kind of the descent, or the return. And then there's a closing phase where you're kind of pretty much back to baseline, but you're still, the music's really important during that time as well. And so, with LSD, of course, the timeline is 8 hours. And with something like ketamine, we're looking at really about, roughly 90 minutes, give or take, depending on route of administration and individual sensitivity, metabolism, that kind of thing. And so knowing the medicine, the type of medicine you're working with, knowing the kind of arc of the medicine effects, the dose response curve, if you will, and kind of arranging the music to really support that arc is a general kind of principle behind creating playlists.
And what are the kinds of musical elements that are helpful in perhaps that transition period from the beginning to the most intense, kind of let's just maybe call it the come up period? Are there certain types of musical elements that help patients perhaps go deeper and get into that more intense state?
Yeah, I think there are generally, and it somewhat depends on the medicine you're working with, because different medicines have different signatures, but there's a common kind of transition into a more kind of activated state as the medicine's coming on. And so, I'm generally kind of bringing in, maybe I'm using more atmospheric ambient music for the opening phase, and kind of easy music, and then friendly music, and then kind of bringing in a little more rhythmic elements, increasing the tempo, and kind of moving into a little bit more what I would call like activating or deepening kinds of music that kind of helps people to access emotionality, kind of supports the movement of the journey, kind of carries someone forward. And so, yeah, those are some of the elements that come to mind in that transition to building and peak phases.
Yeah. So when you bring on that activating, so you said like you start with some atmospheric, you bring in some more maybe percussive, the tempo rises a little, and then you said you bring in some activating. By activating, do you mean, and I'm trying to picture this, do you mean that is there like a darkness? Are these minor chords, or is this a happiness? Are we trying to musically bring them to maybe a confrontational place in their mind? Or are we trying to bring them to a happy place so that they're not afraid? Like, is there that kind of decision made? Like, what kinds of things are activating in that portion of time?
That's a great question, and I think that maybe depends on who you ask. But for me, I think the goal of a good playlist is to ultimately uplift the listener. And so, using melody, beautiful music to kind of to connect with joy, bliss, love. These are kind of like really pretty of primary importance, I feel, in the playlist. But just as a human being goes through a range of emotions in a day, in a life, you want to kind of create a playlist that's going to move into different kind of emotional states. So you're not just doing really uplifting, happy music, right? You're bringing in sadness, you're bringing in activate kind of. I will sprinkle in some dissonant sounds sometimes, or I think you can have too much dissonance or too much challenging music in a playlist that can be actually distracting from the process. But the reason to bring those elements in is to kind of help clients to access, we could call it shadow material, bringing the unconscious into the conscious. And those might be, unresolved grief, or anger, or regret, and but kind of helping the client to kind of know all of the different dimensions of their experience, or not all of them, but at least some of them that they may have repressed, forgotten, avoided. And so I think a playlist without shadow elements in it is also missing something. Yeah.
That makes sense. And what types of things do you use musically to bring them back down out of that intense session as the experience is winding up?
Right. So that's really the place for more heart-centered music. Um, it's not really so much a place for like driving, activating tracks, but I think I like to kind of go back and forth between soothing tracks and like deepening tracks or activating tracks to kind of give it texture. But this phase of like coming back, it's more about connecting with the heart, you kind of, trying to think about, like, this is kind of more like emotional. You're kind of like easing back down, and oftentimes there can be catharsis at the peak, but oftentimes it's like there's other things going on at the peak, that visions, and then like sometimes the emotional expression comes out in this phase. So really bringing in, I bring in kind of often my favorite emotional tracks, and I particularly like sad tracks. That those are often the most beautiful for me. So bring in some sadness and some bittersweetness, but also joyous tracks. You also will sometimes bring in kind of some what I would call it spiritual music, like chanting or chorus. I try not to use lyrics in the client's native tongue, and usually reserve lyrical tracks for kind of the last quarter of the session. But a good lyrical track that has like beautiful lyrics and heart-centered can really hit the spot at times. So yeah.
Nice. I'm so glad you brought up lyrics, because one of the things I wanted to bring up, just out of tiny share of my own, is I was in a ceremony once, and the soundtrack went to, and it's a very famous track at this point, where it's Alan Watts speaking, and I think it's maybe over some East Forest. And I have been in other breathwork ceremonies where like we were after, it was after the breath work, we're laying there, and then that came on during our kind of like meditation, whatever. That was fine. I could even listen to it and understand and whatever. But in the ceremony that I was in, it just sounded like a scary, booming voice of God, and it was absolutely inappropriate. And so I think, it's good to put a fine point on lyrics first, and then second, just having like a random voice that comes up and starts talking, like you said, in your native language. I'm guessing my sense, I am not an expert in this, but my sense would be, and I'd love to hear your thought, and you kind of alluded to this, is that like putting things in their native language is probably more directive than we're looking for in a session.
I think so. I think that's fair, and it also kind of we're meaning making creatures, and so when we hear someone talking, we want to figure out what they're saying, and that can like really pull you out of this kind of trance state, which is often beyond language and beyond verbal understanding. And so it can really pull you out. So that's the risk there. I was curious, do you remember what phase of the journey you were in when you heard that booming voice?
This was one of the worst ceremonies I've ever been in. So there were many times that like it wasn't just like a come on and then a come out, because the dosing had been done improperly. So I think I might have been in the initial come down from an underdosed session. And so I mean, also, just for everybody else out there, I have had some bad sessions. This person goes to like starts doing the dishes very loudly at some point. So there were many things that had gone wrong. The last thing you want besides Alan Watts yelling at you is dishes
Yeah,
happening.
leave the dishwater
Right.
washer sounds out of the
I
plate.
was just like, you could have waited. I know. This is why I'm so like put such a fine point on all the episodes we do about selecting the right retreat center and facilitator, because a bad one can really mess things up for you. But yeah, I think, and then I was just already upset that the like ceremony hadn't been deep enough, and then there's a guy yelling, and I was like, oh, this is too much. But something that also has come up, and this is something going back to the individuality of this that may be hard to know, is that the other thing that has pulled me out, or maybe directed my mind in a way that shouldn't have, is I've definitely also been in a ceremony where the playlist involved the podcast theme, this show's theme. And, it's something that I hear while I'm working and editing this podcast. And
Mhm.
so to have something that is like directly associated with a, non-relax, not that the podcast is hard to do, but, like when I'm editing, that is I'm not relaxed while I'm editing. I'm, focused on all the things that and so it's just a little distracting. And so I guess my question is kind of, how do you individualize a playlist, and try to avoid maybe things? I'm guessing that generally you'd want to avoid songs that they know almost as much as you'd want to avoid their own language, because they might already have memories associated with that song.
Yeah, that's right, Lynn Marie. Yeah, really, the more unfamiliar and novel the music, the less associations, the less their predictive machinery comes online to try to recognize and then maybe to also like figure out, okay, do I like this track? Do I not? And what is it? And what's my favorite part of the track? And that whole kind of predictive default mode network oriented capacity can be triggered. And so, but if obviously if you're not familiar with the track, you're listening kind of with new ears, and you're able to kind of be more fully in the experience. I think that's interesting that you heard the theme song of the podcast during the journey, and like I guess just a little bit of devil's advocate, like I mean, there's no way that you could have planned that. They probably didn't intentionally
No.
do that, but it came up and took you maybe took you out. But I guess there could be value there of like taking you back into like your work mode and having this kind of different kind of space and time to like be with that and explore that, and maybe express whatever feelings that you maybe don't normally have access to. around that. So
Yeah, very fair. It felt very much like a full circle moment when you do a podcast about psychedelics and the song on that podcast comes up while you're doing a psychedelic. That was basically the songs by Porangi. Like it's not a shock that it's going to be in a psychedelic playlist. But speaking
right.
of that, that does Porangi has a lot of nature sounds in his works. So I was going to ask, I think some of the research was done like, is classical music the way to go? And I was even surprised when I saw that that was what was used in a lot of research study because in a lot of the settings I've been in, it's been more of nature sounds. And so is there research on, let's start with by asking, like, is there research that classical versus tonal? I think I've discussed this on a podcast about 57 episodes ago that I do not remember, but can you go into what is known about the kind of those genres of music?
Yeah, there's not a lot of research on it. I'm excited about more kind of kind of granular and technical kind of research around the kinds of music that work better or worse for sessions. There is a study that I don't remember the authors, but it was kind of, oh wait, I think it's Matt oh God, he's at John Hopkins.
Johnson?
Matt Johnson, thank you. Uh, he did a study comparing overtone music and classical music in psilocybin sessions. And they did find that people generally preferred the overtone playlist to the classical playlist. And more importantly, I think, or more interestingly, people reported higher frequency of mystical experiences with the overtone versus the classical. I don't think they were like dramatically different, but there was a pattern there that is interesting. And so that kind of challenges this more traditional preferencing of classical music for psychedelic sessions. And I think it also speaks to um, just this more general kind of idea that taste is so subjective, and that really knowing your client and talking with them beforehand about their taste, about their and letting that information really inform how you create the playlist is really important. Um, and so yeah, there's not just I have, I don't know, I probably have like 20 or so like pet playlists that I've used at various times. I know that like generally works for people, and but like it's good to have a variety of playlists, and maybe you create a new playlist for someone if you don't have a preset playlist that works. um and so but yeah, kind of starting with the individual and knowing the individual is really kind of the best place to start. um
Yeah,
yeah.
that makes sense. And also, the overtone preference makes sense to me because when do I sit around and listen to overtone music? Never. So I have no association with it, right? And so to me, that could be what meeting God sounds like because I don't know, right? Who knows what is overtone, right? But classical, we've listened, we went to the symphony with our grade school field trip kind of thing, or like I've listened to classical in the car. Like I think there's just it makes sense to me why you'd have more mystical experience, like you said, the higher frequency of mystical experiences when using overtone, because to me it just sounds like what an out of body experience would sound like, as opposed to classical, which is we have kind of a very like 3D real world context for where we tend to hear classical music.
Sure. And that can be also, exactly, and that can be a challenge too when someone's um more insistent or just attached to using their own music in psychedelic sessions. And yeah, I'm more likely to kind of be more kind of, I mean, I think it's good to just be flexible with that in general. But like if someone's journeyed a lot, for example, had many psychedelic experiences and kind of knows what music works for them, then that's I'm kind of more likely to kind of collaborate with them around creating a playlist, bringing some of their tracks in, kind of doing a hybrid. But if someone's never had a psychedelic journey but really insists on using certain music, I try to encourage them to be open to, like let's have a session with some of the music that I feel is like going to be really kind of supportive of the arc of the medicine effects and the journey, and then we can kind of go from there. And usually um, they're usually pleasantly surprised. And I think also, like, one of the benefits of doing psychedelic therapy is that you can surrender control over elements of set and setting. Not that those aren't negotiable and ongoingly negotiable as they should be, but there's something about, like, okay, they've got the music taken care of, the room set up, everything's in its right place. All I have to do is fast from food for a few hours, have my intention, and kind of step into the journey, and that can help someone to really just trust and surrender more to the experience.
Yeah. I love that point. I love that I feel supported so much that I only have to bring myself. That's a great feeling. I think that lends to you being able to let go even more when you don't have to, oh, I controlled this playlist. See, my, like your head is still holding on to a thing that there's a lot of grasping versus not, right? There's like the letting go period. And I think if you can start by letting go ahead of time, like you said, if you've engendered enough trust in them to have them say, go ahead and make the playlist, Dr. Sienknecht, then I imagine their letting go has already started, and that probably facilitates things for
Right,
them.
right. And during the intake and prep kind of process of the treatment, if there's some anxiety coming up around the music, or they're having a hard time trusting, which is not, that's fine too, and that's valid, and good that if they communicate that, because it's honest, right? And so there can be a process in the preparation phase of uh, building rapport, developing good, kind of a good enough trusting relationship. And around the music specifically, sometimes I'll send them playlists that I tend to use for the first series of sessions, and encourage them to kind of maybe listen through, not intensely, to, because we still want the music to be somewhat unfamiliar, but take a listen to a few tracks, see what playlist calls to you. And then sometimes I've even like proposed that we do like a little mini journey in a preparation session where I'll lie down on the futon, put the eye shades on, I'll put the music on for about 20 minutes or something, and we'll just kind of see how that is. And that can be really a great way to learn what a journey kind of feels like and what to expect, and also to have dialogue around the music itself, like, well, maybe this one worked but this didn't work, and so kind of to learn through experience that way it's another good way to kind of build that trust.
Yeah, absolutely. And something came to mind as you were mentioning this. If you're in a session with a patient, client, and the one of two things happens. Either the song is for some reason activating them in a way that is uncomfortable and they express that to you, like you said, or perhaps their session has timed out differently from how you like, oh, while they're in the come down and I'm still playing the activating music and I would like to play the come down music. What is the subtlest way you have found to, because I'm imagining if I express and then they just like the music change really abruptly, then that might be a little harsh in either scenario. How do you kind of gently rearrange things as you're going?
Yeah, that's a good question. So there's not really a right or wrong there. And I think it's more about like being attuned to the client's process. And, sometimes if, okay, so it's time to start coming down, but they're still activated and they're working through some like really maybe important material. Um, yeah, do you bring in more soothing music to kind of start to bring them back, or do you maybe keep activating music going, or even like bring in more rhythmic and kinetic music to kind of help them to go even deeper into it? And so all of those are options, and it depends a lot on your clinical intuition and your attunement to the client's process. And there's a way in which you kind of know intuitively, and sometimes through dialogue, checking in with the client to see what's needed. But there's a lot to be said for clinical intuition in those cases. Like Stan Groff really had this kind of very I don't know how to describe it, but this sense that when something big is coming up, uh, encouraging someone to actually make it bigger, breathe into it, see if you can kind of accentuate and express what's coming up and stay with it as a way of really working through something and not kind of aborting the right? Like this is coming up for a reason. It's important. It's uncomfortable. It's scary, but see if you can stay with it and move through it, and using music to kind of support that process. Sometimes that's appropriate, and sometimes that's really significant. And there's a therapeutic opportunity to be missed if you don't do that. But other times there's a sense like, oh, well, this has been, maybe there's a kind of a looping that's happening, and the client feels like stuck, or feels like, I'm really overwhelmed, like it's too much. And so then kind of, if you have a sense of that, then I think, yeah, bringing in less rhythmic, more heart-centered music, violin, acoustic guitar, to kind of, that more soothing, kind of grounding kind of music can be helpful. And so, yeah, it's a kind of a nuanced answer there, but there's no right or wrong, really.
Got it. Got it. And when you brought up that last thing, it reminded me that I was going to ask you, is there a utility in bringing nature elements? Like a lot of what I've heard during sessions, there's like some crickets or some frogs or some brook like rain or whatever it is. And I know, we've done episodes here about how psychedelics in certain settings can increase nature connectedness. But I wondered if there was a benefit to using sounds from nature.
Definitely. I love sounds from nature when I'm journeying, and not just with plant medicines as well, but actually, interestingly, with ketamine, uh, which may turn out to be, there's some research that it's produced by a fungus in nature. So, you know, but it's like you wouldn't think that the nature sounds were important, maybe necessarily with ketamine, a more synthetic drug, but it can be very powerful. It can bring in this kind of textured kind of feel to the music. It's coming from outside. Is it coming from the music? Is it coming from inside? It can like trigger memories of childhood. I did, particularly with my ketamine playlist, I'll bring in nature sounds in the middle, but also sprinkled in throughout, and then kind of at the end too. East Forest does a great job of bringing in these kind of environmental sounds, and I think it generally works best for like the opening and closing phases of a journey, but it can also be profound sprinkled throughout.
Nice. I like that. I like the sprinkling concept because it's kind of like these little touch points that bring you back. One last question that is a little obscure, but you told me the name of the chapter and it included the word vibration, which reminded me of these playlists that I've seen on Spotify that are like 585 hertz or whatever. I'm just randomly guessing numbers, but there's like, this is the frequency of love and this is the frequency of this. And then there's also binaural beats. And does any of that weigh in at all to, I mean, maybe we have no, I'm sure we have no research on this. I don't know, but like, has there been any research that you know of certain frequencies having effects or certain binaural situations having any kind of effects?
There's actually quite a bit of research on that.
Well,
Yeah, that there's definitely research supporting binaural beats and certain frequencies, and I'm interested in that, and I think um, there is a science there actually, and I don't often use binaural beats or that kind of thing in the playlist unless it's kind of in the beginning or the end. Um, but I'm very curious about that and open to how the research develops, and maybe there are maybe there is maybe binaural beats throughout the music throughout the playlist is going to lead to greater therapeutic progress, and now I'm definitely going to be using more of them, but for now I don't really use that much.
so the research on binaural beats is not in a psychedelic setting, correct?
That's not specific to
Okay.
psychedelic therapy, right?
Okay.
So
And what
that's
kinds of things has that research found to be the benefits of binaural beats, just since we're talking about it, if you happen to know?
Yeah, I mean, I just know very generally it's not a area of a specialty of mine, but like lowering blood pressure, I think, stress reduction. Sometimes binaural beats are used for sleep, sleep induction. So those kind of things.
Yeah.
Usually more on the kind of relaxing end. You're not using binaural beats for like activation. I don't think it's more about like calming the nervous system. Um, I'm just thinking about with trance induction, there's some science behind that there's certain kind of beats per minute in the track that kind of induce like that alpha theta state. But I think binaural beats are often used more for, well, maybe they're, yeah, I guess I don't know. Maybe they can be used for trance induction, but I think of it more as like induction of like more even like delta waves.
Yeah. Well, it may be interesting, like you said, to use that in the come down when we're trying to relax them back in after the activating state. So it will be interesting. I mean, the entire show, my, 160, 70, however many episodes all end with, and then we can't wait to see what the research says when we, there's so many more areas of research to delve into. So, I,
There's a striking absence of research on music and psychedelics.
yeah.
So it's I could name like a few books and articles, but we have a lot to learn.
Indeed, we do. Well, thank you so much for getting us started into this conversation. We could have many more follow-up episodes as that research gets done. But in the meantime, can you please tell people where to find out more about you and your work?
Yeah, thanks, Marie. So I teach a music module at Polaris. It's a 4-hour webinar with Ryan Hoffman on kind of the basics of using music in ketamine assisted therapy sessions. And this is for healthcare workers, licensed healthcare workers. So not only therapists, but nurses and physicians and people who are working with the medicine, clergy even. And then we're just developing an advanced music module for CAP sessions, ketamine sessions, and we're bringing in musicians and practitioners in the field who have been working with music for their careers, to kind of have more dialogue and perspectives on the use of music and show like kind of individual processes and preferences. And so Byron Metcalf, who has been working in this space for I think 30 or 40 years. Worked with Stanislav Grof in the early days of holotropic breath work. He's going to be joining us. We have David Starfire, who has been creating music for ketamine journeys, specifically in the retreat space. And then Claudia Cuentas, who is a therapist in Portland, Oregon, who works with ketamine and psilocybin. So we'll have a variety of voices, and there'll be an experiential component of that too. So that look out for that kind of early next year. And then, yeah, the chapter in the book, Integral Psychedelic Therapy, check that out if you're interested in learning more. And yeah, consider Polaris Insight Center trainings if you're someone who wants to get more training in ketamine assisted psychotherapy.
Absolutely. Polaris is one of the OGs, and we're so grateful for all the work you've done over the many, many years. And anybody who wants to find out any of those things you just mentioned, check out the show notes. And Eric, thank you so much for joining us today. It's been a true pleasure to learn more from you.
Same, Lynn Marie. Thank you for having me on. It's been a pleasure.
Absolutely. All right. For everyone else out there, until next time.